Hello everyone. Very good evening to all of you. I welcome you all for today's session and I welcome the batch 3rd Prof 1.2. In this batch, today's subject is ENT and in ENT we are going to continue larynx. We already started larynx. In larynx, today I am going to teach you one of the most trickiest topic of larynx. What's that? That's laryngeal paralysis. So today I'm going to teach you laryngeal paralysis. I must say it is one of the most trickiest as well as interesting topic in larynx. So I will teach you laryngeal paralysis in a way you won't be able to forget it. So let me share my screen quickly with you and start the session. I guess you can see the screen. Can you see the screen? I guess you can see the screen. So let's start it. As I told you in this batch, the 3rd Prof 1.0, today's subject is ENT. And in ENT today, we are going to study laryngeal paralysis. So I am going to teach you laryngeal paralysis, but you will be able to understand the laryngeal paralysis if you understand two things very clearly. Number one, the muscles of the larynx, and number two, the nerve supply of the larynx. If you understand the muscle and nerve supply, understanding laryngeal paralysis will be fun for you. So the muscles of the larynx, I already taught you the 9 intrinsic muscles of larynx in anatomy. Here, quickly we will revise it. Revision is must for this. Okay. Quickly we will revise these muscles. Then I will tell you the nerve supply of larynx and then I will be starting the various types of laryngeal paralysis. Today in this session, I am going to teach you the 6 type of laryngeal paralysis. Okay. In the form of a master table. So let's start it. So as I told you, before I start, you must revise the muscles of the larynx. Under these heading, I am going to continue the topic that is laryngeal paralysis. I will be starting with muscles of larynx, which is already covered in anatomy. Here, quickly we will revise it. So let's start the muscles of larynx. As I told you, the muscles of larynx, we divide the muscles of larynx in 2 headings, intrinsic muscle and extrinsic muscle. What do you mean by intrinsic muscle? What do you mean by extrinsic muscle? There are 2 types of muscles in the larynx, intrinsic and extrinsic. Intrinsic muscles are the muscles which are confined entirely inside the larynx. As the name indicates, they are intrinsic. They are inside the larynx, and extrinsic muscles are the muscles which are between larynx and the surrounding structure. It connects the larynx with other structure, the surrounding structure, okay, the other structures. So that is extrinsic muscle. So currently I am interested in intrinsic muscles, the intrinsic muscles of the larynx. Got it? So here we have to revise quickly the intrinsic muscles of the larynx. Okay, so let's start the intrinsic muscles. There are 9 intrinsic muscles. The first thing, you have to learn the names of these 9 muscles. So I'm going to teach you these 9 muscles. I'm going to revise you these 9 muscles in 3 forms. First of all, we will see a sketch diagram in which I will help you in learning the names of these 9 muscles. Then we will see the images along with the videos in which I will tell you the origin, insertion, action as well as nerve supply of these muscles. Okay, so first we will see the sketch diagram. To understand the sketch diagram, this is the basic diagram of the larynx. I guess everyone till now can understand this diagram. How many cartilages we have? We have 3 paired and 3 unpaired, total 9 cartilages in the larynx. You can see in this diagram, this is thyroid, the central cartilage. Below the thyroid, we have cricoid. The cricoid is the only complete ring. You can see this is the front of the cricoid you can appreciate, and this is the back of the cricoid. You can appreciate the cricoid is the complete cartilage. And above that, we have epiglottis. So thyroid is in the center. Above thyroid, there is epiglottis. Below thyroid, there is cricoid. This is the front view. On the back view, on the posterior view, I mean, this is the anterior view. On the posterior view, you can appreciate cricoid is there. As I told you, cricoid is a complete ring. That's why cricoid is there on the posterior also. And you can see 2 arytenoids are there. These 2 are arytenoids. Okay. So I will draw them in the form of a sketch diagram. Currently, I'm interested in these cartilages only. Okay. So you can see I am drawing cricoid at the center. I'm telling you a sketch diagram in which we will revise the 9 intrinsic muscles of the larynx first. You can see the thyroid. The thyroid is at the center. I'm sorry. The thyroid is at the center. Can you appreciate the sketch diagram? The thyroid is at the center. Okay. Now you can see the cricoid is below the thyroid. This is the front of cricoid. This is the back of the cricoid. The front of the cricoid is below the thyroid and this is the back because cricoid is a complete ring. Okay. Now you can see there are 2 arytenoids. One right arytenoid, one left arytenoid. You can appreciate on the back, there are 2 arytenoids. Okay. And you can appreciate this is epiglottis. The epiglottis is above the thyroid. So how many cartilages we have seen? So you can see the thyroid at the center. Above the thyroid, we are having epiglottis. Below the thyroid, we are having cricoid, the front of the cricoid, the back of the cricoid. And these are the 2 arytenoid, the right and the left arytenoid. You can appreciate. You can appreciate the same over here again. You can see the thyroid at the center. You can appreciate the thyroid at the center. Can we revise it? The thyroid at the center. Appreciate thyroid at the center, thyroid at the center. Above the thyroid, epiglottis. Here is the epiglottis. Below the thyroid, there is cricoid, the front of the cricoid, the back of the cricoid. Can you see below the thyroid, the front of the cricoid, the back of the cricoid? So you can see the same over here also. You can see this is front of cricoid, this is back of cricoid, and you can appreciate here are the two arytenoids. This is arytenoid, this is arytenoid. These are the two arytenoids over here. Okay, so same sketch diagram, same orientation I have told you of the cartilage. Now let's start the muscles. I will be taking first of all thyroid as a center. I will be telling you total 9 muscles one by one. Let's take the thyroid as a center. There are 2 muscles arise from the thyroid. Okay, I will show you the muscles in the form of the arrows. Okay, so what are the 2 muscles arising from the thyroid? You can see the first muscle arising, connecting the thyroid to epiglottis. Now my arrows are very peculiar. The arrows have a head and a tail. The head shows the insertion and the tail shows the origin. So the muscle is from origin towards the insertion. That's I mean. So this muscle, okay, what is the name of this muscle? The name of this muscle is thyroepiglottic. Okay, the name of muscles are very simple. The name of the muscles are the name of the 2 cartilages it is connecting. This muscle is connecting 2 cartilage. Which 2 cartilage it is connecting? It is connecting thyroid with the epiglottis. This muscle is connecting thyroid with the epiglottis. So what is the name? It is thyroepiglottic. From where to where? Where is the origin? Where is the insertion? Look at the arrow. So the arrow is starting from thyroid. So it is origin is thyroid and the arrow is ending towards the epiglottis. So it is insertion is on the epiglottis. So it is thyroepiglottic. The first muscle is thyroepiglottic. The second muscle also arises from the thyroid, which connect the thyroid to the arytenoid. So what is the name of this muscle? It is thyroarytenoid. You can see the second muscle, thyroarytenoid. So there are 2 muscles, people who are arising from thyroid. See, I have done the numbering also. So appreciate my efforts, please. The 2 muscles arising from the thyroid, thyro. Both of them arise from the thyroid. One connect the thyroid with the epiglottis, so thyroepiglottic. One connect the thyroid with the arytenoid, so thyroarytenoid. Appreciate the 2 muscles in front of you. Got it? Everyone got these 2 muscles? Okay. So these are the 2 muscles till now. Now, we will take cricoid as center. Cricoid. There are 3 muscles arising from the cricoid, connecting the cricoid with some other cartilage. So the third muscle, okay, which is arising from the cricoid, it connect the cricoid with the thyroid. So what is the name of this muscle? It connect the cricoid with the thyroid. You can see cricoid with the thyroid. So the name of this muscle is cricothyroid. Cricothyroid, you can appreciate. Okay, one more muscle arising from the cricoid, the second muscle. There are total 3 muscles arise from the cricoid. The first is cricothyroid. The second is cricoarytenoid. It is connecting the cricoid and the arytenoid. It is known as lateral cricoarytenoid. It is connecting the lateral side of the cricoid with the arytenoid. That's why lateral cricoarytenoid. Lateral cricoarytenoid. And the next muscle is again connecting the cricoid with the arytenoid. You will say, ma'am, what is this? Here also cricoid is connected with the arytenoid. Here also cricoid is connected with the arytenoid. So, but here the lateral part of the cricoid is connected with the arytenoid. Here the posterior part of the cricoid is connected with the arytenoid. So this is lateral cricoarytenoid. This is posterior cricoarytenoid. Both are cricoarytenoid. They are connecting the cricoid with the arytenoid. Cricoid with the arytenoid. This is lateral part of the cricoid with the arytenoid. This is posterior part of the cricoid with the arytenoid. I will show you images and videos. Wait a while. But here you can revise. So these are the 3 muscles arising from the cricoid. You can see I have done the color coding. The 2 muscles arising from the thyroid are shown with black color and the 3 muscles arising from the cricoid is shown with orange color. You can appreciate 5 muscles till now. You can revise all 5. 4 more to go. Total 9 muscles are there. The 5 are in front of you. Appreciate the 2 muscles arise from the thyroid. You can see thyroepiglottic and thyroarytenoid. Thyroepiglottic and thyroarytenoid. You can appreciate here. You can appreciate here. Okay. This is thyroid, thyroepiglottic, thyroarytenoid. And appreciate the 3 muscles arising from the cricoid. Cricothyroid, lateral cricoarytenoid, and posterior cricoarytenoid. You can see their names over here. Okay, now, so 5 muscles are done till now. Okay, now the remaining 4 muscles out of 9, they arise from the arytenoid. Now let's take arytenoids as center. First, I have taken thyroid as center and told you two muscles. Then I took cricoid as a center and I told you 3 muscles. And now I am taking arytenoid as a center and I will let you know the remaining 4 muscles over here. So what are the remaining 4 muscles over here? Okay, taking the arytenoid as a center. So the first muscle out of the 4, the first connecting the arytenoid with the epiglottis. So what is the name of this muscle? Aryepiglottic. epiglottic. It is connecting the arytenoid with the epiglottis. That's why it is known as epiglottic. This is epiglottic. Okay, this is the first muscle arising from the arytenoid. The next muscle arising from the arytenoid connect the arytenoid to the thyroid. Okay, this muscle is known as vocalis. Actually, it's a modification. You can see I already taught you a muscle which is connecting the thyroid to arytenoid. See this number 2, second number muscle, that is thyroarytenoid. Okay, and now I am saying a muscle arising from the arytenoid till thyroid. So basically, it's a modification. It's a modification of thyroarytenoid only, and this is known as vocalis. This is known as vocalis. Okay, this is known as vocalis. Now, so these are the 2 muscles arising from the arytenoid. 2 more. Total 4 muscles arise from the arytenoid. 2 are in front of you, 2 more to go. The remaining 2 connects the 2 arytenoid with each other. The remaining 2 muscles connect the 2 arytenoid with each other. The first connect the arytenoid. Okay, like this, it is known as transverse arytenoid. Transverse arytenoid, and second connect the arytenoid like this. It is known as oblique arytenoid. The transverse arytenoid and oblique arytenoid together known as interarytenoid. It is together known as interarytenoid because they are connecting the 2 arytenoid with each other. So sometimes it can be considered as a one muscle, but actually they are 2 different muscles, transverse arytenoid and oblique arytenoid. So these are the total 9 muscles in front of you. People, I tried my best to show you the 9 muscles. We have already done this in anatomy in detail. Here we are doing a quick revision to understand the laryngeal paralysis. You can't understand laryngeal paralysis unless and until you understand these muscles and their nerve supply. Got it? So these are the 9 muscles in front of you. Okay. Got it? Everyone got it? Can we revise it? What are the 9 muscles? Let me help you in the revision. So let's take the thyroid as a center. The 2 muscles arising from the thyroid is thyroid epiglottis and thyroarytenoid. Thyroepiglottis, thyroarytenoid. Now let's take cricoid as a center. Let's take cricoid as a center, and 3 muscles arising from the cricoid. Cricothyroid, lateral cricoarytenoid, and posterior cricoarytenoid. Cricothyroid, lateral cricoarytenoid, posterior cricoarytenoid. Now let's take arytenoid as a center. Let's take arytenoid as a center, and there are 4 muscles arising from the arytenoid. First connecting arytenoid to epiglottis, it is epiglottic. The second connecting arytenoid with the thyroid, it's vocalis. It's a modified version of thyroarytenoid only. And the remaining 2 are connecting the 2 arytenoid with each other. This is transverse arytenoid and this is oblique arytenoid. The transverse and oblique arytenoid together known as interarytenoid. I hope it's crystal clear to all of you. So these are the 9 muscles. Now what is the function of these muscles? You tell me. So what is the function? Based on the function, we divide these 9 muscles in 3 categories. So out of this 9, you tell me which of them is the opener of larynx, which of them is closing the larynx, which of them causing abduction of the larynx, which of them is causing adduction of the larynx, which of them is causing, adduction and abduction of the vocal cord, which of them causing tensor, relaxer and modulator of the vocal cord. Out of these 9. So one by one we will take you. The answer is in front of you, but don't mug it up. I will explain you each and every function of these muscles. So let's divide them in 3 categories. You can see these are the opener and closer of the larynx. These are the adductor and abductor of the vocal cord. These are tensor, relaxer and modulator of the vocal cord. We are dividing them in 3 categories. I will fill this table with you. So take out your notebook and take out your pen and start filling this table with me right now. Okay, so take out. One by one, we will take the category. Let's start with the first category quickly. The first category is opener and closer of the larynx. The opener and closer. So what do you mean by opener and closer of the larynx? So you know we have larynx and the lid of the larynx is the epiglottis. I guess I already taught you in the anatomy. The lid of the larynx, in the supraglottis we have a structure epiglottis. It acts as a lid of the larynx. So it opens and closes. It opens and closes. So all the time it opens so that we can do the respiration like this. So the air is going in, coming out. It is open, but at the time of swallowing, it closes. At the time of swallowing, if I swallow anything like this, at that time it closes so that the food particle don't enter in the larynx and trachea. It prevents the respiratory tract from entering the food particle. That's known as aspiration. Okay, so that is the epiglottis which is opening and closing. So opening and closing. So name the muscle which causes opening and closing. You can appreciate in this video where is epiglottis. So you can see this structure. Can you appreciate this structure? Let me highlight. This structure is epiglottis. Can you see it's closing, it's opening. It's closing, it's opening. So all the time it's open only, but as soon as the food coming, you can see the food particle is coming so that it is closing. You can see normally the food particle is present in the oropharynx over here. Now from oropharynx, the food particle have two pathway to go. It can go in the esophagus and digestive tract, or else it can go in the larynx and trachea and respiratory tract. Where you want the food to go? We want the food to go in here, in digestive tract, in esophagus. We do not want the food to go in trachea and respiratory tract. This is known as aspiration. We do not want aspiration. So, but here there are two pathways. So who is stopping the food to enter this pathway and enter here? So as soon as we do the swallowing, it is the epiglottis. It is the onus of the epiglottis who is closing the larynx. So food have no choice. When the food is present, it is swallowed. It has no choice. It has to go in esophagus because this side it is closed by the epiglottis. Epiglottis is not allowing the food to enter in the trachea. So I hope the closing is important. The closing is done at the time of swallowing. Without swallowing, it is always open. So currently I am not swallowing anything. So it's open in me. But if I swallow like this, if I swallow anything, it will close. I hope you got it. You can see the same over in this video, the opening and closing. Appreciate this is epiglottis. Can you appreciate this is epiglottis? Now see, as soon as the food bolus is coming, how it closed, then it open again. Then it will open again. It will open again. It's like that. I hope you got it. I hope you got it. Name the muscles. So name the muscles. There are two muscles. Now everyone got it. The opening and closing is done by the epiglottis only. It is the epiglottis who is opening and closing. So the two muscles should be attached with the epiglottis only. Right or wrong? So you can see the name of the two muscles. What are the name of the two muscles? Both of them are attached to the epiglottis. Okay. One is thyroepiglottis. One is eriepiglottis. You can see. Now can you see this is cross section? I mean lateral view of the larynx. Can you tell me the cartilages here? Now you all can appreciate this is epiglottis. Say yes. You can see this is front containing the thyroid and this is back containing the arytenoid. So see the three cartilages. This is epiglottis, this is thyroid and this is arytenoid. Arytenoid is present at the back, thyroid is at the front and epiglottis at top. It is at present at the above. Now name the muscles who are connecting. Name the muscles. So name the muscle which is connecting epiglottis and thyroid. It is thyroepiglottic. Thyroepiglottic. And name the muscle which is connecting epiglottis with the arytenoid. It is eriepiglottic. It is eriepiglottic. I hope you got the two muscle. Now use your common sense. The muscle which is present in the front, that is thyroepiglottic, it will cause opening. And the muscle which is present at the back, that is eriepiglottic, it will cause closing. So the thyroepiglottic is opener and the eriepiglottic is closer. I hope everyone got it. When we want to open it during respiration. So thyroepiglottic is responsible for respiration. Okay. And when we want the closing, at the time of swallowing. So the eriepiglottic is responsible for swallowing. I hope you got it. The same you can see here. Please simultaneously learn this table. Ultimately, you have to learn this table. So who is causing opening of the larynx? Thyroepiglotticus. Okay, it is responsible for respiration. And who is causing closing of the larynx? It is eriepiglotticus, which is responsible for swallowing. At the time of swallowing, it's action there. Say, so all the time it's open, but only at the time we eat and we swallow, it closes. So opening is done by thyroepiglottis and closing is done by eriepiglottis. And in both of them, the main cartilage is epiglottis, which is moving. Okay, epiglottis, it is moving. So the muscle which is connecting the epiglottis to thyroid opens it and the muscle which connect the epiglottis with the arytenoid closes it. Got it? Got it. Everyone, you can see here. Can you appreciate? Can you appreciate the epiglottis? How it is opening, closing, opening, closing. So name the muscle which is opening it, thyroepiglottis. Name the muscle which is closing it, eriepiglottis. When opening is required, all the time for respiration. When closing is required, during swallowing. Everyone got it? You can see the same over here also in this diagram also. Where are these two muscles I am talking about? Where is thyroepiglottic and where is eriepiglottic? Where is epiglottis? Connect the epiglottis with thyroid and connect the epiglottis with the arytenoid. You can see this one is opening, this one is closing. The one which is in front is opening, the one which is back is closing. See, this is opener, this is closer. This is opener, this is closer. I hope you got it. Now coming on the second category quickly. The second category is abduction and adduction of the vocal cord. Okay, what is abduction and adduction? I already taught you in anatomy. Adduction, adduction, add. Adduction yani bringing them closer. Add them, bring them closer. The two vocal cords are close to each other. Okay, and abduction means kidnapping. Taking far away. The two vocal cords are far away from each other. So if the two vocal cords are close to each other, it's adduction. If they are far away from each other, it's abduction. Okay, the same you can see in this video. I will show you adduction and abduction in this video. You can appreciate the two vocal cords, how they are coming close, how they are going far. Appreciate. This is adduction. This is abduction. This is adduction. This is abduction. Again, see. This is adduction. This is abduction. Adduction means close. Abduction means far. Okay, common sense. I hope everyone got it. The same you can see here also. You can see this is abduction. This is adduction. Okay, this is abduction. So this is adduction, adduction. This is abduction. Okay, I hope you got the meaning. So when the both of them are required, this is for the vocal cords, the true vocal cords, not the false vocal cord. Okay, so we want abduction so that they are far. Can you see this one is far from each other? See, we want abduction at the time of respiration, breathing, so that the air can go in and come out. We want abduction at the time of breathing. Okay, but how? I told you now. Have you watched my session on the physiology of larynx, the episode 1? I taught you how voice is generated in the larynx. Okay, so for generating the voice, we have to bring the two vocal cords close. We have to do the adduction. We have to bring them close and vibrate them so that the sound is generated. So while speaking or singing, or it is known as phonation, for phonation, adduction is required. So tell me when abduction is required, when adduction is required. Abduction, okay, when you want the vocal cord to be far away at the time of respiration, breathing, so that the air can go in and come out. And when you want the two vocal cord close to each other, so and they vibrate, we want them during phonation, during speaking. Currently I am speaking, so I want this. Okay, during speaking I cannot speak constantly. In between I take breathe and I do like that. So at the time it's like this. Okay, and again I'm speaking, it's like this. Again I breathe in between, it's like this. So adduction and abduction are required. Currently I'm breathing also and speaking also. Okay, so I'm non-stop speaking. So this one is there in me. So but in between you see I'm taking breath also. So it is like that. Okay, so adduction and abduction are required. I will show you how we do speaking, phonation. During phonation you can see the two vocal cords, they come close to each other and they vibrate. Again I will show you. They come close to each other, you see, and they vibrate. This is how the sound or voice is generated. I hope everyone got it. So name the muscles which are abductor and adductor. I guess everyone got what is abduction, and abduction is required for respiration. And what is adduction? Adduction is required for phonation. So there is one muscle, one and only. There is one and only which is abductor. And there are four muscles which are adductor. Okay. For speaking, God has given us four muscles. Okay. But for inhalation, the great God has given us one muscle. The great God has one. So we have to learn the name of those. Okay. I will show you. So let's start with one and only abductor. Tell me the one and only abductor. Can you see the two vocal cords? Where are the two vocal cords? Okay, name a muscle which is taking the vocal cords far from each other. Name the muscle. So the name of muscle is posterior cricoarytenoid, not lateral. Posterior cricoarytenoid. You can see the two vocal cords. You can see this is a vocal cord. You can see this is a vocal cord. And this is the muscle. You can see when this muscle contract, it takes the vocal cord far from each other so that the space is created and the person can inhale. So this muscle is required for inhalation. Okay, and that's why it is known as safety muscle. Till this muscle is working, we can inhale. If this muscle stop working, you know, the vocal cord will come close and we can't take inhalation and we can die. That's why this muscle is known as safety muscle, the posterior cricoarytenoid. It is required for inhalation. I hope everyone got it. I will show you a video in which the function of the posterior cricoarytenoid is shown. You can see in this video, you can appreciate this is posterior cricoarytenoid. How it is, you can appreciate this is the muscle. How it is contracting and taking the vocal cords far from each other. So it is required for abduction. The posterior cricoarytenoid is required for abduction, and that's why it is known as safety muscle. Now coming on adductors, there are four adductors. Okay, but the most important adductor among the four is one. There are four, but the most important adductor which bring the vocal cords close to each other. Can you see? The vocal cords are close to each other. Okay, this is the muscle. The name of this muscle is lateral cricoarytenoid. So posterior cricoarytenoid and lateral cricoarytenoid. Okay, the posterior cricoarytenoid take the vocal cord away from each other, and the lateral cricoarytenoid take the vocal cord close to each other. Okay, the lateral cricoarytenoid is the main adductor, and we need the vocal cord in adducted position close to each other during whisper. Okay, we need the action during whisper. Now you can see where are the vocal cords. Can you highlight the vocal cords in this image? I will explain you something over here. You can see this is a vocal cord, this is a vocal cord. Since they come closer, the space is obliterated. But the space is not completely obliterated. Still there is a space between the two arytenoid. Can you see? So during the functionality of this muscle, there is still a space during which we can do the whisper and we can do the exhalation. For inhalation, we need a big inlet. This is the inhalation. During inhalation, we need a big inlet. But during exhalation, the exhalation can be done from this also. From this triangle, a small space you can see between two arytenoids. And during whisper, you know what is whisper? See, I'm whispering. I am Dr. Priyanka. It's whisper. I guess you can hear. So whisper. It's whisper. So whisper. So during whisper, this muscle comes in the role. So it is required for whisper. Okay. Now the second adductor, second and third adductor, there are four adductors. The second and third adductor is the interarytenoid. There are two type of interarytenoid. One is transverse, arytenoid, and the other is not shown here is oblique arytenoid. So transverse and oblique arytenoid together known as interarytenoid. Okay, they bring the vocal cords completely close to each other. Now see, you can see the two vocal cords are close and the space between the arytenoid is also gone. The space, now compare the space here and compare the space here. The space between the two vocal cords is also gone. So it's complete closure. It's complete closure and it is required for phonation. These two muscles are the main muscles for phonation. Okay, while we are talking and speaking. So I will show you first the action of lateral cricoarytenoid. You can see lateral, this is lateral, this muscle is lateral cricoarytenoid. It is bringing the vocal cord closer, but still after closure, the space between two arytenoids still persists, and that is required for whisper and exhalation. And here I will show you one by one the action of the two interarytenoids. First, see the action of transverse arytenoid. This is transverse arytenoid. When it contract, it completely bring the two vocal cord close to each other, no space even between the arytenoid. And now see the action of oblique arytenoid. Let me show you the action of oblique arytenoid. You can see this muscle is oblique arytenoid. Again, it is bringing the two vocal cord when it is contracting close to each other. And again, there is no space between the arytenoids. So these are the two muscles required during phonation and exhalation. Okay, and the last muscle, the fourth and the last muscle, which is adductor, which is not very important adductor, is cricothyroid. Okay, now you can see this cross section. In this, you can appreciate this is thyroid cartilage. This is thyroid. Can you see? This is cricoid, the complete ring, cricoid. And these are the two arytenoid. These are the two arytenoid. Now, can you see this muscle? See this muscle, which is connecting the thyroid with the cricoid. Appreciate this muscle. Connecting the thyroid with the cricoid, connecting the thyroid with the cricoid. When this muscle contract, it will bring the two vocal cord close to each other. But it is not very strong adductor. It is a main tensor, but it is not very strong adductor. But to complete the list, you can know it is also an adductor. You can see. This is cricothyroid. Appreciate this muscle is cricothyroid. Can you see this muscle is cricothyroid? When it is contracting, it is slightly bringing the vocal cord closer, not very much. So these are the four adductors. What are the four adductors? Can you tell me? Tell me one abductor and the four adductor. They are in front of you. One abductor and four adductor. Can you tell me? The one abductor which is taking the vocal cord far from each other. See here, it is posterior cricoarytenoid. Okay, posterior cricoid also known as safety muscle. And the four adductor, one is lateral cricoarytenoid, one is transverse arytenoid, one is oblique arytenoid, and one is cricothyroid. The most important among which is this one. Okay, this one is required for whisper. These two are required for phonation, and this one is not having much action. And here, the posterior cricoarytenoid, since it's a abductor, it is required for inhalation. It is required. So learn their function also. You can mark the same muscles over here. You can appreciate the one and only abductor. This one. The one and only abductor. Okay. The posterior cricoarytenoid. This one. The safety muscle. And the remaining four adductors. You can appreciate the remaining four adductors. The lateral cricoarytenoid, the transverse arytenoid, oblique arytenoid, and cricothyroid. You can appreciate. Okay, I have highlighted their names also. I hope you got it. Coming on the last category. Since it's a revision, people, I have to be fast. Coming on the last category, the tensor, relaxer, and modulator of the vocal cord. So who is the tensor of the vocal cord? Who is the relaxer of vocal cord? And who is the modulator of vocal cord? Now you see, you will say, ma'am, the respiration, inhalation, exhalation already done. Okay, and the phonation and whisper is also done. Now, why you require tensor, relaxer, and modulator? Now, the pitch of the voice can be changed. We have already done the phonation. Phonation means creating the sound. But in phonation, we have two options. Okay, the sound of high pitch and the sound of low pitch. We can change our pitch. Okay, females have high pitch, physiologically, and males have low pitch. I can change my pitch. I will say a statement in 3 pitches: normal pitch, high pitch, and low pitch. This is my normal pitch. I guess everyone is aware about of my voice. Yes, this is my normal pitch voice. Okay, now I'm increasing the pitch. I am Dr. Priyanka. This is high pitch. I am Dr. Priyanka. This is normal pitch. I am Dr. Priyanka. This is high pitch. I am Dr. Priyanka. I can decrease the pitch. So females have high pitch, males have low pitch, and voluntarily for some time we can increase the pitch or decrease the pitch. So name the muscles which are responsible over here. So you have to learn one golden rule. Pitch is directly proportional to length of vocal cord. Learn this golden rule. Pitch is directly proportional to length of the vocal cord. More is the length of vocal cord, more is the pitch, and less is the length of the vocal cord, less is the pitch. So changing the pitch, if you want to change the pitch, you have to change the length of the vocal cord. So when you increase the length of the vocal cord, it is known as tensor muscle. There is a muscle tensor muscle which increases the length of vocal cord. And decreasing the length of vocal cord, there is a muscle relaxer muscle. Relaxer muscle decreases the length. So tensor increases the length, increases the pitch. Relaxer decreases the length, decreases the pitch. And there is a muscle which is known as modulator that can do both, which can increase as well as decrease. That is modulator of vocal cord. You can see the diagram over here. Very good diagram. You all can appreciate here the vocal cords are of increased length. Okay. And here the vocal cord of decreased length. Okay. So here the tensor, increased length, high pitch. Here the relaxer, decreased length, low pitch. Now use your common sense. If you want to increase the length of the vocal cord, this is thyroid. Okay. And this is arytenoids, the two arytenoids you can see. These are the two arytenoids. This is interarytenoid. If you want to increase the length, you have to take the thyroid forward and arytenoid backward so that the length will be more. And if you want to decrease the length, use common sense. You have to bring thyroid backward and arytenoid forward. Okay, so you can decrease the length. So name such muscles. So who is the tensor, who is the relaxer, and who is the modulator? 3 questions, 3 answers. One by one, all 3 are shown here. You can see tensor. Tensor is cricothyroid. Cricothyroid. Can you see this muscle which is connecting the thyroid with the cricoid? You can understand this diagram. This is thyroid, this is cricoid. So the muscle which is connecting thyroid and cricoid is cricothyroid. You can imagine when it is contracting, it will increase the length of the vocal cord. So it will increase the pitch. Okay. Now the one which decreases the pitch is thyroarytenoid. Can you see this is thyroarytenoid? This is thyroid. This is thyroid. And this is the two arytenoids. So name the muscle which is connecting thyroid and arytenoid. This one. Thyroarytenoid. This muscle. Thyroarytenoid. Okay, when it contracts, it will relax the vocal cord, decrease the length, so it decreases the pitch. Thyroarytenoid. But the lower portion of thyroarytenoid. Can you see thyroarytenoid ka lower portion? This. The lower portion of the same thyroarytenoid acts as a modulator. It can increase as well as decrease. The anterior 1/3 is attached to the vocal cord, so it increases the pitch. The posterior 1/3 of this muscle is not attached to the vocal cord, so it decreases the pitch. It is known as vocalis. Vocalis is the modulator. Okay, so you can see, I will show you the videos. This is cricothyroid. Cricothyroid is the tensor. Okay, you can see when this cricothyroid is acting, it is tensing the vocal cord. Okay, this is thyroarytenoid. It will relax the vocal cord. When it will contract, the vocal cord length is decreasing. It is relaxing. It is relaxing. And vocalis is the modulator. You can see. So here I have shown you the tensor. Okay, the tensor is cricothyroid. The relaxer is thyroarytenoid. And modulator is vocalis. Okay, so here you can see all 9 muscles, their names, okay, and their function. Okay, now one muscle is common. Cricothyroid is coming 2 times. The cricothyroid is adductor as well as tensor. But mainly it's a tensor. Mainly it's not an adductor, but you should learn it as both adductor as well as tensor. So only one muscle is coming 2 times out of the 9 muscle. You can count there are 10. One is repeating. Which one is repeating? There is cricoarytenoid. So it is tensor. Mainly it's a tensor. The cricoarytenoid is mainly tensor, but it is having a slight adductor function also. Now if you understood this now, understanding the paralysis will be fun for you. Believe my words. Please believe my words. Okay. Now we will revise quickly the 9 muscle. Tell me the opener and closer. Who's the opener? Who's the closer? Who's the opener and closer? You can see the 2 muscles over here. Both of them are connected to the epiglottis. Okay. The one which is connecting thyroid to epiglottis is opener, and the one which is connecting arytenoid to epiglottis is closer. So thyroepiglotticus and epiglotticus. So these are the 2 muscles. Okay, opening is required at the time of respiration. Closing is required at the time of swallowing. Okay, now name the abductor and adductor. Abductor is only one, posterior cricoarytenoid. Okay, and the adductors are 4. Lateral cricoarytenoid, transverse arytenoid, oblique arytenoid. These are together interarytenoid and cricothyroid. Okay, so you can see. Okay, so you can see their functions. And last, tensor, relaxer, and modulator. The tensor is cricothyroid, relaxer is thyroidectomy, and modulator is vocalis. These are required for changing the pitch. Okay, these are required for inhalation and phonation. This is required for respiration and swallowing. I hope you are getting it. Okay, if I wish, I can show you this table, okay, and ask you to learn in one shot. Okay, I have already taught you 35 minutes till now. Okay, yes or no? So, but it was important, people. Okay, you have to understand the muscles, otherwise you can't understand the paralysis. Got it? Everyone got it? You can see the 9 muscles in front of you. All 9 muscles. All 9 muscles in front of you. You should know the name of these 9 muscles. You should know their action and you should know their function. You should know one of the muscles, that is cricothyroid, acting double action. It is acting as an adductor as well as tensor. Adductor as well as tensor. If you are done with the muscles, tell me the nerve supply of these muscles. Tell me the nerves. How many nerves are there in the larynx? And which nerve is supplying which muscle? Okay, you remember this table. I will add one more column here, the nerves. Okay, in this table. Now everyone is aware of this table, then only you can proceed ahead. Okay, so the muscles of the larynx is done. The muscles of the larynx is done. Now coming on the nerves of the larynx. How many nerves we have in the larynx? In the larynx, we are having 2 nerves. What are the 2 nerves in the larynx? Recurrent laryngeal nerve. It is known as RLN. Recurrent laryngeal nerve and superior laryngeal nerve. The superior laryngeal nerve known as SLN. So there are 2 nerves which supply the larynx, sensory as well as motor. So RLN and SLN. Recurrent laryngeal nerve, RLN, and superior laryngeal nerve, SLN. Okay, these are the 2 nerves. Now this is your master table. If you want to understand paralysis, the tricky 6 type of paralysis, you have to learn this. This is your master table. Recurrent laryngeal nerve and superior laryngeal nerve. Both of them is having sensory as well as motor supply. Let's start with the recurrent laryngeal nerve. First, I will tell you its origin and its course. Then I will tell you what it supply. What is the sensory supply of this nerve? What is the motor supply of this nerve? But before coming on the sensory and the motor supply of this nerve, let me tell you its origin and course. Okay, first I will let you know its origin and course. So let's start recurrent laryngeal nerve. The recurrent laryngeal nerve is right side we have right recurrent laryngeal nerve and left side we have left recurrent laryngeal nerve. But the origin and course is different. So that's why I'm taking 2 different, the right RLN and the left RLN. Their origin and course is not same. That's why I have to take them separately. Normally, if it is same, I will not take it twice. For SLN, I will teach you only SLN course, origin and course. I will not tell you right SLN and left SLN because it is same for both. But here I'm telling you different course, different origin and course. So let's start right RLN. Right RLN. Can you see this diagram? Can you see this diagram? In this diagram, both the RLN arise from vagus. Both the RLN, right as well as left, they arise from vagus now. Okay, so can you see? First, let me tell you the right RLN. The right RLN. Can you see the right vagus? First, highlight the right vagus. Where is the right side vagus? So this is the right vagus. Can you see this is right side of the patient? And this yellow nerve. Can you see this yellow nerve? This is right vagus. Say yes. This is right vagus. I'm highlighting it again. This is right vagus. Okay, now from the right vagus, right recurrent laryngeal nerve arises from the right vagus at the level of the subclavian artery. Can you see? This is subclavian artery. At the level of the subclavian artery, can you see here? I don't know whether you can. This is right RLN. So this is right RLN arising from the right vagus. This is right vagus. From the right vagus, this is right RLN arising and going upward. Going upward. Taking a U-turn, taking a hook and going upward. So see, first you see this yellow color vagus. Everyone see. From this, you can see this is subclavian artery. At the level of the subclavian artery, see this dotted line. Can you see this dotted line? I appreciate I'm highlighting. This is right RLN. It is arising at the level of the subclavian artery. Okay. Okay, from the vagus, hooking around it and then ascending upward between the trachea and esophagus. Then ascending upward between the trachea and esophagus. This is right RLN. Now coming on left RLN. Okay, it arises from the left vagus. Where is left vagus? You can appreciate this is left vagus. Appreciate this is left vagus. Can you appreciate? I have highlighted. Start from here. This is left vagus. From the left vagus at the arch of aorta. Can you see this is arch of aorta? At the level of arch of aorta, the left RLN arising. Can you see this dotted line? This. It is arising and going upward. So both of them go upward. Can you see the right RLN also go upward? The left RLN also ascend upward. Both of them. I'm highlighting both. See everyone here. This is right RLN arising from the right vagus. Okay, and going upward. And this is left RLN arising from the left vagus and going upward. But the point is, they are arising at different levels. The right RLN arise at the level of subclavian artery. and left RLN is arising at the level of arch of aorta. Okay, both of them are going upward, the same thing. So left RLN arising from vagus at the level of arch of aorta, then loop around it and then ascend between trachea and esophagus. So the further course is common, but the point of arise is different. You can see first highlight the two vagus. This is right vagus and this is left vagus. Then highlight the two arteries which I am talking about. This is subclavian artery and this is arch of aorta. Now see the two vagus, see the two RLN. So right RLN arises at the level of subclavian artery from right vagus, and the left RLN arising from the left vagus at the level of arch of aorta and then ascend upward. I hope you all got it. So you can appreciate the two. Now compare right and left. Can you compare right and left RLN? Please do compare. Please do compare. I will highlight, you compare. So this is right RLN and this is left RLN. Okay, further course is common. You tell me which one is longer. Simple question. Which one is longer? Which one is having longer course? This one arising from here and then going upward. This one arising much below and then going upward. This one is arising at the level of subclavian artery. This one is arising at the level of arch of aorta. So obviously this is right one and this is left one. So left one is having longer course. The left one is having longer course because it is arising at the level of arch of aorta instead of subclavian artery. So it is more prone to injury. Very common MCQ. Why left is more prone to injury? So there are two RLN. Recurrent laryngeal nerve are of two type. The right and the left. Now you get a MCQ. Why left is more prone to injury? Why left is more prone to injury? The answer is it is having longer course. Longer course. So chances are more it is having injury. This one is having shorter course. Why the longer and shorter course? This one arises at the level of subclavian artery and this one arises at the level of arch of aorta. I hope everyone got it. Okay, I hope everyone got it. Now come on the nerve supply. Okay, RLN supply what? RLN supply what? See, where is RLN? Don't come on. First you see RLN. Where is RLN? This one is RLN. Can you see this one is RLN? So tell me, RLN supply sensory supply to what and motor supply to what? You know sensory and motor, I guess everyone understand. RLN supply sensory supply below the vocal cord. Whereas this is sensory supply. Okay, here I will mark sensory supply and here I will mark motor supply. You can see all 9 muscles over here. So it's supply below the vocal cord. Can you see? This is vocal cord. So below the vocal cord, this area is supplied by RLN, right as well as left. Okay, so right side is supplied by right RLN, the left side is supplied by left RLN. So this area below the vocal cord, below this area, let me highlight this area. This area, the sensory supply to this area, the below vocal cord is by RLN. The right by the right side, the left by the left side. Please, people do understand this. If you do understand the paralysis, you will tell me. I will not tell you the paralysis. You will tell me if you understand this. Okay, this is a sensory supply. Now motor supply. It supply all intrinsic muscle, 8 intrinsic muscle, except one of them, cricothyroid. Cricothyroid is not supplied by RLN. It is supplied by SLN. Okay, so out of the 9, it supplies 8 intrinsic muscle. Can you see? So here is cricothyroid, except cricothyroid, it supplies all other muscle. It supplies all other muscle. So this is the sensory and the motor supply of RLN. Please mark it. Mark the sensory supply. The sensory supply is below vocal cord. Okay, this area is supplied by RLN. And motor supply, except cricothyroid, all other muscles are supplied by RLN. Please learn it by heart. All other muscles, 8 muscles except cricothyroid, it is supplied by RLN. So you got the sensory and the motor supply. The same thing is written. Read it. Read it. Sensory supply below vocal cord, motor supply, all intrinsic muscle except cricothyroid. Now come on SLN. Before tell you the sensory and motor supply, I must tell you its origin and course. First, I must tell you its origin and course. Then I will tell you the supply. What is the origin? What is the origin? It is supplied from inferior ganglion of the vagus. Where is the inferior ganglion? You can see this is the inferior ganglion. The inferior ganglion of the vagus. From the inferior ganglion of the vagus, this nerve which is coming is SLN. You can appreciate this one is SLN. I have highlighted. This one is SLN. It is dividing into 2 parts. Internal SLN, external SLN. You can see it arises at the level of internal ganglion. Okay, it convert into internal and external. The internal one enter into the larynx by piercing cricohyoid membrane. It enter inside the larynx by piercing thyrohyoid membrane. I'm sorry, thyroid. I already taught you this in anatomy. Can you see where is thyroid, where is hyoid? Tell me, this is hyoid bone and this is thyroid cartilage. Can you see this cartilage is thyroid cartilage. Can you tell me a membrane connecting the two? Can you tell me a membrane connecting the two? Thyrohyoid membrane. Thyrohyoid membrane. Can you tell me a membrane connect this? Okay, can you see I taught you there. This is pierced by internal laryngeal nerve. See, by piercing this membrane, the internal branch is entering in the larynx. So you can appreciate the same over here. So where is inferior ganglion? This is inferior ganglion, people. From the inferior ganglion, here is SLN coming. Okay, superior laryngeal nerve. It divides into internal and external. External will move only externally, but the internal, you can see it is entering inside by piercing this membrane. It is entering inside. So this is the course. Okay, right and left don't have different course. Right and left have same course. Okay, it is having two branches, internal and external. Now see the sensory and the motor supply over here of SLN. See the sensory and motor supply. Internal do only sensory supply and external branch do the motor supply. Okay, here we don't have two separate sensory and motor. It is RLN only which is doing sensory and motor supply. Okay, but SLN have two branches. One is internal, one is external. The internal is having sensory, the sensory above vocal cord. The sensory supply above vocal cord. This area is supplied by SLN, internal branch of SLN. Okay, and motor may all muscles are already supplied by RLN. Now, which one is not supplied? Cricothyroid. So this one supplied cricothyroid. So it supply only cricothyroid. Only cricothyroid. It's external branch. I hope you got it, people. Tell me the summary. Tell me the summary. Who will tell me the summary? Tell me the sensory and motor supply of RLN and SLN. Sensory and motor supply of RLN and SLN. Let's talk about RLN. I will mark the RLN supply with black color. RLN sensory supply is below vocal cord. Okay, RLN sensory supply is below vocal cord. Okay, now come on SLN. SLN sensory supply is above vocal cord. It's above vocal cord. Okay, this is SLN. SLN, superior laryngeal nerve. Okay, its external branch do so. It's, internal branch of SLN do so. So this is SLN. Let me write. SLN. SLN ka internal branch. Okay, is giving the sensory supply. And this one is RLN. RLN don't have the branches. Okay, so below vocal cord, it's RLN. Above vocal cord, it's SLN. At vocal cord, both. At vocal cord, both. Mind my words, people. If you want to understand paralysis, I have really worked hard for this session. And that's why the session is delayed. I'm confessing. But it will be worth waiting and watching both. Each and every second you are utilizing in watching this video, my promise to all of you, it is worth. It is worth. Okay, and the wait is also worth. You will realize at the end of the session. No one will teach you paralysis in a super simplified manner. I have done a real hard work in preparing this for you. Okay, anyways, come back. You can see the two nerves, RLN and SLN. So RLN do the sensory supply below the vocal cord. SLN, the internal branch of the SLN, do the sensory supply above the vocal cord. And at vocal cord, both of them supply. Now coming on the motor supply. RLN, RLN supply all the muscles except cricothyroid. Except cricothyroid. RN supply all other muscles except cricothyroid. See, my black color is RLN. And SLN supply only cricothyroid. SLN supply only cricothyroid. Okay, so this is SLN. SLN key external branch supply cricothyroid. And this one is RLN. RLN supplying the remaining 8 muscles. So appreciate the RLN and SLN. In both these diagrams, the RLN is black color and the SLN is blue color. Appreciate the sensory supply of RLN, SLN and appreciate the motor supply of RLN, SLN. If it fits in your mind now, understanding paralysis is fun for you. Please, I will be very fast in the paralysis. I will be teaching you 6 types of paralysis. Now it's common sense. Now I will do RLN paralysis, unilateral RLN, bilateral RLN. I will do SLN paralysis, unilateral SLN, bilateral SLN. And I will do combined paralysis. Combined paralysis, I will do paralysis of both. Okay, unilateral combined and bilateral combined. So you can use your common sense using this knowledge which I'm showing you on this page. Can we revise last time? This is the most important portion of this session here I'm telling you. Okay, the next 5-10 minutes are the most important session because if you understand this, understanding paralysis is very easy. Okay, very easy. It's like the trick you are understanding. Like in mathematics, once you understand how to add, how to subtract, then whatever the numbers are there, you can do so. You have to learn once the trick, how to do so. So learn the trick over here. There are 2 nerves in the larynx. Recurrent laryngeal nerve known as RLN and superior laryngeal nerve known as SLN. Now tell me the sensory supply. RLN do the sensory supply below the vocal cord. SLN do the sensory supply above the vocal cord. At the vocal cord, both of them supply. at the vocal cord, both of them supply. Okay, so this one is RLN. I have shown you black color, and this one is SLN. I'm showing you with blue color. SLN is having two branches. So it is the internal branch of the SLN which is doing this sensory function. Now come on the motor function. There are total 9 muscles in front of you. So out of 9, which one is supplying what? Okay, out of the 9, 8 of them is supplied by RLN. Out of the 9, 8 of them is supplied by RLN. 8 of them, except cricothyroid. Except cricothyroid. Okay. The remaining all is supplied by RLN. Okay. And this cricothyroid which is not supplied by RLN is supplied by SLN. So it's very easy. Okay. So here I am writing RLN which is supplying 8 muscles. Okay. Except cricothyroid. And here I am writing SLN. SLN ka external branch which is supplying only cricothyroid. So it's in front of you. You have to learn it. You have to mug it. There is no other option. There is no other choice. You have to understand this. Okay. So I hope everyone got it. One more thing on which frequently MCQ comes, especially in the surgery in your exam. RLN is close to, where is RLN and where is SLN? Can you highlight RLN? Please highlight RLN in this diagram. Can you highlight RLN? Can you highlight the RLN? Here is the RLN. This one. You can see right RLN. Say yes. This is RLN. Okay. And where is the SLN? External SLN. This one is the SLN and this one is the external branch. This is internal. This one is external. So RLN is in close contact with inferior thyroid artery. This one. And SLN is in close contact with superior thyroid artery. This one. So while doing the surgery of the thyroid, since RLN is in close contact with inferior thyroid artery and SLN is in close contact with external branch of SLN is close contact with superior thyroid artery, they can be injured. So external branch of SLN is in close contact with superior thyroid artery and RLN is close contact with inferior thyroid artery. These are your most important MCQs either from ENT or surgery. I don't know, but you get these MCQs in your NEET or competitive exam. You can understand it here. I've highlighted both the nerves and both the arteries. You can understand it here. So the nerve supply of the larynx is done. Okay, so we have understood the muscles of larynx. I taught you the 9 muscles. I taught you the 2 nerves. Which nerve is supplying which muscle, you know. Now let's revise the sensory and motor supply and let's start the laryngeal paralysis then. Let's revise the sensory and motor supply of the larynx quickly. Let's quickly revise the sensory and the motor supply of the larynx. Okay, so first you tell me the sensory supply. Where is the sensory supply? Sensory supply above the vocal cord, below the vocal cord. So sensory supply above the vocal cord is supplied by internal branch of superior laryngeal nerve. And sensory supply below the vocal cord is supplied by RLN nerve. Okay, so I already taught you here. We are just revising. So what I am saying, below vocal cord and above vocal cord. Below vocal cord, it is RLN which is doing the sensory supply. Above vocal cord, it is SLN. SLN ka kaun sa branch? It's internal branch of SLN, which is supplying above and at vocal cord, both of them. So same thing is written. Above vocal cord, below vocal cord, at vocal cord. You can read. Okay. Above vocal cord, it's SLN. SLN ka internal branch. Below vocal cord, RLN. Okay. And vocal cord, dual supply. So whatever I have highlighted, the same thing I have written in words. Rather than mugging up in the words, it won't work. You won't retain. But here, see in the diagram. See, this is a sensory supply. Motor supply, you tell me. You tell me motor supply. You tell me. So out of all the 9 muscles, you can see they all are supplied by RLN except cricothyroid, the third one, cricothyroid, which is supplied by SLN. SLN ka external branch. Okay, the same thing is written. Okay, you can see. So all the muscles, 8 of them, except cricothyroid. The remaining 8 are supplied by RLN. Okay, cricothyroid is the one which is left over here, no? Which is paired, which is left. So this cricothyroid is supplied by SLN. Okay, it's external branch, the external branch of SLN. Okay, and there is a muscle interarytenoid. Where is interarytenoid? You can see the 2 types of interarytenoid. You can see this is transverse arytenoid and this is oblique arytenoid. Since they are present in center, just learn they are supplied by right as well as left. They are supplied by RLN only. You will see, ma'am, they are coming in the 9 muscle. There are total 9 muscle. Now, people, there are total 9 muscle. Okay, there are total 9 muscle. You know the name of these 9 muscle. It's in front of you. These are the 9 muscle. I am saying out of the 9, except cricothyroid, 8 of them is supplied by RLN. I am saying this. So you will see, ma'am, interarytenoid is also there. Yes, both the interarytenoid, that is transverse and oblique, they're also supplied by RLN. But the unique feature is that the remaining out of the 8, The remaining 6 are supplied right by right, left by left. I mean, the thyroepiglottic, right thyroepiglottic is supplied by right RLN. The left is supplied by left RLN. Okay, the right thyroarytenoid is supplied by right RLN. The left thyroarytenoid is supplied by the left one. Same with the lateral cricoarytenoid, posterior cricoarytenoid, epiglottic, vocalis. The right one is supplied by right RLN. The left is supplied by left RLN. But these two are supplied by bilateral right and left, both because they are in the center. They're supplied by RLN only. They're supplied by RLN only, but right and left both. But except cricothyroid. The cricothyroid is not supplied by RLN. It is supplied by SLN. I hope you got it, what I'm saying over here. Same thing is written. So motor supply, all intrinsic muscles except cricothyroid is supplied by RLN, and the cricothyroid is supplied by SLN, the external branch of the SLN. And interthyroid is supplied by RLN only, but bilateral RLN. It's right and left both RLN because they are in the center. Okay, so can you tell me the name of the nerves? This table, you are already aware of this table. Now write the name of nerves. Except cricothyroid, remaining all is supplied by RLN. The cricothyroid is supplied by SLN, the external branch of SLN. External branch of SLN. The remaining all are RLN. Write down RLN, RLN, RLN. Write down 8 times. 8 times RLN. So this is the thing. What I mean to say. So every format I tell you, people, please retain. Only cricothyroid is supplied by SLN. It's external, E for external branch of the superior laryngeal nerve, SLN. Okay, and remaining all are RLN, RLN. These two by bilateral RLN. I mean interthyroid here. This one is bilateral RLN, but it's RLN only. I hope you got it. So if you got, people, it was a big portion. If you got the muscles and the nerves of the larynx, you know, the nerve supply, the sensory and motor. Now let me tell you how many type of positions of the vocal cords are there. Before I start the various types of laryngeal paralysis, let me tell you the positions of the vocal cord. Let me tell you the positions. How many type of positions of the vocal cords? I'm talking about true vocal cord. If I'm saying vocal cord only by default, it means true vocal cord. I'm not talking about the false vocal cord. It's the true vocal cord which is responsible for phonation. Okay, I guess you know what's the difference between true and false vocal cord. I taught you very well in anatomy. So how many type of positions? There are 5 type of positions of the vocal cords. They are in front of you. The median position, in which both the vocal cords are at the center. There is no space. Okay, 0. They are in midline. Both the vocal cords are in midline and there is no space between them. 0 millimeter space. Okay, from the center, if they are little bit far away from each other, okay, from center, this is also 1.5 millimeter, this is also 1 point, the right and left. So total space in between is 3 millimeter. It is known as paramedian. This position. Okay, so this position, you can see this is center, and vocal cord is 1.5. This side vocal cord is also 1.5. This side vocal cord is also. So 1.5, total 3 millimeter. Okay, total. So 1.5, 1.5, it will be 3 millimeter. 3 millimeter. Okay. So the next is cadaveric. If from the center they are 3.5 each of them. Okay. From the center, this is center. Each of them is 3.5 millimeter away. So 3.5 and 3.5, it will be 7 millimeter. Okay. Then partial abduction and full abduction. Partial abduction means each of them is 7 millimeter. Each of them is 7 millimeter away. So total 14 millimeter gap will be there. And full abduction means each of them is 9.5 millimeter. This one. 9.5 millimeter away. So total gap is 19 millimeter. Okay, I will draw the 5 diagrams for you. I will try, give me a minute. I will try to draw all these diagrams for you. Okay, just a second. Can you see the screen again? I guess you can. Okay, so let's draw it. Let me draw the 9 diagrams for you. So here I am drawing these diagrams. I will be drawing the 5 diagrams for you. I must have drawn it previously. It's okay. Here I will try. Okay, I'm trying to draw them equal, but I'm unable. Anyways, so if 2 vocal cords are at the center, you can see here I'm drawing. Okay, if 2 vocal cords, both of them are at the center, this is midline. This is first vocal cord, this is second vocal cord. Okay, if both of them are at the center, okay, this is the midline. Let me draw the midline in all of them. This is the midline. So both the vocal cords are at midline. So midline, from midline, that's 0 millimeter. This is the midline. This is the midline. This is the midline. This is the midline. If the two vocal cord, each of them is 1.5 centimeter away from the midline, so total 3 millimeter, this is paramedian. If each of them is 3.5 millimeter away, 3.5 millimeter, total 7 millimeter, it's cadaveric. If each of them is 7 millimeter away, it's partial abduction. If each of them is 9.5, okay, millimeter away, so 9.5 millimeter away, it's full abduction. So see the 5 position. Let me write down the distances to understand. Here the distance is 0 plus 0, total 0. This distance is 1.5, 1.5 and total 3 millimeter. Okay, this distance is 3.5, 3.5, total 7 millimeter. This distance is 7 plus 7, total 14 millimeter. This distance from the center is 9.5 and 9.5. Okay, this distance I'm talking. Okay, total 19 millimeter. Okay, I hope you all got it. I hope this distance, the distance between the two vocal cords I'm talking. I hope you are getting it. Now, what is the name of these? Can you tell me the name of these? This one is known as median. Okay, this one is known as paramedian. Okay, this one is known as cadaveric. Cadaveric. Okay, this one is known as partial abduction and this one is full abduction. Okay, now tell me which one is required when? Which one is required when? Median is required during phonation. This one is required during phonation. I told you when we talk and speaking. So both the vocal cords should be at the center and they vibrate. Then only the talking. How I generate the voice? My both vocal cords should be at the center and they vibrate so that the sound is generated. So this one, the median position is required for phonation. Phonation. Okay. Paramedian is required for whisper. But for whisper, there should be a small gap. If I am talking, the vocal cord should be like this and they vibrate. If I'm whispering, so it should be like this, a little bit gap so that I can whisper. So the paramedian is required for whisper. The paramedian is required for whisper. Median required for phonation, paramedian required for whisper. Cadaveric is not required. I mean, if no muscle is acting out of the 9 muscle, none of them is acting, it will be cadaveric. Cadaveric means none of the muscle. If on the vocal cord, no adductor and no abductor is acting, none of them is acting, it will be in cadaveric position. Cadaveric means death. Okay. If adductor is acting, it will be like this. If abductor is acting, it will be like this. If no adductor, no abductor is acting, it is like this in the center. I hope you are getting it. Now abduction. Let's act abductor on them. This is partial abduction. This is full abduction. Partial and full both are required for inspiration. This is for quiet respiration and this is for deep respiration. This is for deep respiration. I hope you got it. So see their function. See their function also. Which one is required when? Okay. Currently I'm doing quiet respiration, so I need this. Currently I'm talking, so I need this. Currently I can whisper also, so I need this one also. If I do deep respiration, I need this also. Okay. And if I die, I mean none of them is acting on my muscles. Okay. Or if complete laryngeal paralysis occurs, so it will be cadaveric. So I hope you got the positions of the vocal cord. These are the positions of the vocal cord. So how many positions we have? There are 5 positions. Okay. This is cadaveric. If no adductor and abductor act, it is in cadaveric. Okay. If adductor is acting, median or paramedian. If abductor muscles are acting, it is slight abduction or full abduction. I assume you know which is adductor, which is abductor. People, please use your common sense. Adductor, there are 4 adductors I taught you. Name it. And abductor, there is only one abductor. The one and only abductor is posterior cricoarytenoid. The 4 adductors is lateral cricoarytenoid is the main one. After that, the 2 interarytenoid. I mean transverse arytenoid and oblique arytenoid. Okay. And the last one was cricothyroid, which was a weak adductor, but it was adductor. So you should know for median and paramedian position, we need these 4 muscles. Okay. And for slight abduction and full abduction, we need this muscle. Okay. If none of them is acting, it will be cadaveric. It will be cadaveric. People, please do understand. If you are understanding this, then understanding paralysis is very easy for you. The position of the vocal cord. Shall I say again? So we are having adductor and we are having abductor. We are having 2 type of muscles in the vocal cord. You know, we have only 1 abductor and 4 adductors. You know, total 5 muscles causing adduction and abduction. If none of them act, it will be in cadaveric position. Cadaveric position. Okay. If adductors add, it is median or paramedian. If abductors act, it is partial abduction or full abduction. Okay. Okay, got it. Now you know the muscles. You know the muscles. If none of them is acting, it is cadaveric. Okay. If posterior cricoarytenoid is acting, it is partial or full abduction. And adductors are 4. What 4 adductors? Lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, and cricothyroid. If these are acting as an adductor, the vocal cord will be in median or paramedian position. So these are the positions of the vocal cord. You can understand their distance from the midline, the distance with each other. That will be double of this. You can understand I have drawn here. You can appreciate I have drawn everything over here. You can appreciate. So if this distance is 1.5 from the midline, 1.5, so distance of the two vocal cord from each other is 3 millimeter. It's like that. Okay. And for which function they are required in normal health. I hope you got. I hope everyone got it. Okay. Now you are ready to fly. Okay. All the warm up is done. Let's run now. Let's run. So you are ready to start the laryngeal paralysis. Actually, now the session is starting. Session is starting now. I guess you are getting it. Okay, till now it was just warm up. So that you can understand the real disease, the laryngeal paralysis, and it's going to be super easy for you. You can understand. You already know the 9 muscles. You already know the 2 type of nerves. You already know which nerve is supplying the sensory and motor supply to which muscle and where in the larynx. Okay, you already know the 5 type of the positions of the vocal cord and which muscle is responsible for which position of the vocal cord. Now let's start the laryngeal paralysis. How many type of laryngeal paralysis is there? There is 6 type of laryngeal paralysis. What is the 6 type? Actually, there is 3 type. Each of them is of 2 type: unilateral, bilateral, unilateral, bilateral, unilateral, bilateral. So you know the 2 muscles. If there is paralysis of RLN, RLN paralysis. If there is paralysis of SLN, SLN paralysis. And if there is paralysis of both, RLN and SLN. Okay. This is known as RLN paralysis, recurrent laryngeal nerve paralysis. This is known as SLN paralysis, the superior laryngeal nerve paralysis. And this is known as combined or complete paralysis, that is paralysis of both. Now, each of them can be unilateral, bilateral, unilateral, bilateral, unilateral, bilateral. So, total 6 type of paralysis I'm going to teach you people. I'm going to teach you 6 type of paralysis. Okay. Now, you understood this classification? What is the classification of paralysis? Tell me the classification of laryngeal paralysis. Who will tell me? Laryngeal paralysis are of 3 type. Okay, broadly 3 type: RLN paralysis, SLN paralysis, recurrent laryngeal nerve paralysis, superior laryngeal nerve paralysis, and combined. Combined or complete में RLN plus SLN, both are paralyzed. Now each of them is unilateral, bilateral, unilateral, bilateral, unilateral, bilateral. So total it will be of 6 type. Can you enumerate the 6 type? Unilateral RLN paralysis, bilateral RLN paralysis, unilateral SLN paralysis, bilateral SLN paralysis, unilateral combined paralysis, bilateral combined paralysis. So these are the 6 types. Yes, these are the 6 types. Now, people, wait. I'm having a very unique way of teaching you. Wait, you already aware of this? RLN supplies what and what? What is the sensory supply of RLN? What is the motor supply of RLN? You know. SLN, what is the sensory supply of SLN? What is the motor supply of SLN? Why don't you combine this with this? Your 6 paralysis will be done. It will be done. Why don't you combine? Shall I combine? Shall I combine this flowchart with this flowchart? Let's merge the two. Let's merge the two. First you revise. Tell me the sensory supply. Sensory supply. So sensory supply below vocal cord, it's RLN. Okay. Above vocal cord, it's SLN. And vocal cord is both. Okay. This is sensory supply is done. Below vocal cord, it's RLN. Above vocal cord, it's SLN. Okay, tell me the motor supply. Motor supply mein all the muscles, 8 muscles are supplied by RLN except cricothyroid. Okay, and only cricothyroid is supplied by SLN. Only cricothyroid is supplied by SLN. Yes or no? So RLN is supplying all 8 except cricothyroid, and cricothyroid is supplied by SLN. Okay, SLN is having 2 branches. This is the internal branch of SLN which is doing sensory supply, and this is the external branch of SLN which is doing motor supply. So the same thing is written. Let's merge this with the paralysis. I have merged. People, this is my master chart for today. I will explain one by one. This is the master chart. You can understand. Now, I will take the paralysis. I will be starting with unilateral RLN. So what you will do in unilateral RLN, unilaterally, this sensory supply will be gone and this motor supply will be gone. If I teach you bilateral RLN, okay, bilateral RLN paralysis. So bilaterally, this sensory supply and this motor supply will be gone. Common sense. You just keep on applying like mathematics. Let's start SLN. Okay, if I teach you SLN, unilateral SLN. So in unilateral SLN, this sensory and this motor will be gone. Okay, G. Okay. And if I teach you bilateral SLN, in that bilaterally this sensory and motor will be gone. Got it? Got it. When I teach you combined paralysis, when I teach you unilateral combined, so combined means what? The complete sensory and complete motor. Okay. So unilaterally complete sensory and motor will be lost, or bilaterally complete sensory and motor will be lost. Okay, got it. I hope you got the broad idea of what we are going to do. If you know the sensory and motor supply of these nerves, you already know the sensory and motor of RLN. You already know the sensory and motor of SLN. I have marked it with black and blue color. What else you want? And you just merge it. Both the sensory above and below vocal cord, it's complete vocal cord. Both this motor, except cricothyroid and including cricothyroid. So it will be all 9 muscle. So complete mates all. It complete mates all. Okay, and we have to do unilaterally, bilaterally. One by one we have to do. So people, what you are waiting for? Take out your notebook, take out your pen. Nobody in this world, on this planet, I'm sure, is going to teach you this paralysis in such a simple and beautiful way. Yes, so appreciate my efforts. Please do appreciate my efforts. Take out your notebook, take out your pen, and start making this master chart with me right now during the session. If you are doing so once you finish watching this session and once your master chart is ready, take a photograph of the filled version in your copy and send it to me on my personal WhatsApp number. I will be very happy if you are doing so. I will bless you. I will be very happy. Got it? So please follow my instructions. Whatever I am saying, it is worth following and worth listening. Got it? So these are the 6 type of paralysis in front of you. Unilateral RLN, bilateral RLN, unilateral SLN, bilateral SLN, unilateral combined, bilateral combined. I am going to teach you the 6 type of paralysis under a fixed set of ending, and I call it a master chart. First, I will let you know the definition, introduction in each of them, what's going to happen. Then the etiology, why, what are the causes, okay? Then the position of the vocal cord in each of them. You will use your common sense in telling me the position of the vocal cord. You will say in this paralysis, which muscle is paralyzed? If nothing is acting, it's cadaveric. Okay. So which muscles are paralyzed, based on which you will tell me the position. You will tell me the clinical features based on that. And finally, the treatment based on the clinical features. I hope you are getting it. Okay. So we are going to fill it one by one. So actually the session is starting right now. Till now, I have just oriented all of you how to follow it. Okay, how you are going to understand the paralysis. But paralysis is starting right now. So right now I'm starting the session, and the session will be 1.5 hours more ahead. Okay, that will be the main session. That session will be the main session. Till now, it was just for your understanding. So can I start? Can I start the larynx? But it will be very easy for you to understand now. So one by one, we are going to start the various type of laryngeal paralysis, the 6 type of laryngeal paralysis under a fixed set of heading. Got it? Chalo. So let's start it.